Hello, we're here at the Center of Natural Oncology in Del Mar, California, near San Diego. I have some distinguished guests here. On my right is Dr. Alan Schwartz, Director of Holistic Resource Center in Agoura Hills, California. And on my left is prominent American chemist, Mr. Vincent Gamel, Center for Natural Oncology. We're here to talk about Professor Kachatrian's protocol as it applies to some of the patients, some of the initial clinical trials on a smaller scale that were performed here in California, and talk about what's known as the K effect. Here's Dr. Alan Schwartz.
I was privileged to have Dr. Kachatrian, a distinguished Russian scientist and physician, visit our Holistic Resource Center in Agoura, California. I had heard a lot about his work for probably the better part of a year prior to his arrival at our clinic. And Dr. Kachatrian had invited me to bring some patients to Russia, specifically cancer patients, to show how quickly his protocol could reverse cancers. I was enthusiastic about doing that, but due to the cost and other complications involved with the trip to Russia, I wasn't able to get sufficient patients who volunteered to go. And Dr. Kachatrian graciously agreed to come to the United States to see patients at our clinic, not only with cancer, but with a variety of other debilitating conditions, and demonstrate the efficacy of his protocols. The protocols involved basically electrically charged water solutions with specific pHs, that is acidities or alkalinities, and the use of beneficial probiotic organisms given both orally, rectally, and in other manners to people with a variety of health conditions. Dr. Kachatrian mentioned that he had been studying these protocols and perfecting them and refining them over a long period of time, many, many years, on literally tens of thousands of patients. Initially, he was getting very good experiences, he relates, with allergies and other allergic conditions like asthma, and also with people with intestinal complaints like colitis. And in more recent years, he started working with cancer patients. He sent me information by email about a number of cancer patients, specifically 5 patients with stomach cancers, all of whom had advanced cancers, and all of whom seemed to reverse those cancers in a relatively short time. When he came to the clinic, he also had brought with him some videos and other tapes of interviews with his patients in Russia and with other physicians who had evaluated those patients. I was particularly impressed with one very cachectic patient with tuberculosis and cancer who looked like a walking skeleton. Wouldn't have thought that this patient could possibly have been cured of his cancer, as the patient's nutritional condition was so depleted. The patient did ultimately succumb, Dr. Kachatrian mentioned, from the tuberculosis. However, at autopsy, the cancer was totally gone, and I thought this was absolutely incredible, as it takes a good functioning immune system in order to get rid of cancers in most cases. And in this person, was certainly nutritionally deficient, would be expected to have had a highly depleted immune system. Dr. Kachatrian's protocol involves a very unique and, to me, a very startling concept, which is that you can pass electrons in a special bath through a completely sealed bag of electrolyte solution, and by so doing charge that bag electrically such that it has a very high oxidation reduction potential. I'm skeptical because the bag is made of a plastic material that theoretically shouldn't conduct electricity. Nevertheless, he demonstrated to my satisfaction, and that also of Dr. Vincent Gamble, that this can be done. And the way we demonstrate this is by measuring the oxidation reduction potential and the pH of the solution prior to Dr. Kachatrian's using his special techniques to charge the solution, and then measuring it afterwards. And the difference was certainly very significant and consistent from batch to batch. Dr. Kachatrian uses this usually as a Ringer's lactate or other salt solution, like a normal sodium chloride solution, to infuse these electrons into the body, and this is given usually as an IV drip over a short period of time. He uses specific pH adjusted solutions for enemas depending on the nature of the condition that he's treating. And in the short discussion time, I won't be going into extreme details in this regard. There's usually a 3-day period where most people start off with an acid enema, and then they get an alkaline-adjusted water enema generally after that, although again this will vary a little from condition to condition. They're also, in Russia I understand, allowed to be immersed in baths with electrically charged water solutions. In the United States we didn't have access to that at our clinic, but we were using a nebulized solution that he prepared, again with the electrically charged water. It's a well-known fact that cell membranes must maintain a potential difference between the outside and inside of the membrane in order for the cell to be healthy. These membranes not only surround the cell, but they surround the nucleus and all the organelles inside the cell, like the mitochondria. The potential difference must be maintained, and if it drops, the cell isn't able to pump various and sundry things in and out that it needs in order to maintain its healthy status. One of the considerations I gave as to why Dr. Kachatrian's protocols were helpful is that I believe that by charging the electrically appropriately charged solutions, that you're reinvigorating the cells and maintaining the cell membrane potential that is necessary for maintaining the health of the cell. Although this appears to be something that we need to further investigate in terms of the mechanism. The other thought I had is that a lot of health depends on the correct balance between creating free radicals and neutralizing excessive free radicals in the body. The way to neutralize free radicals is to use antioxidants, which basically are chemicals that give up their electrons freely. There is no better antioxidant than free electrons themselves. They will neutralize the free radicals, which are electron stealing agents. And by providing this highly electrically charged solution, Dr. Kachatrian has come up with the ultimate antioxidant. So by neutralizing free radicals and by normalizing cellular membranes, he is almost instantly making cells healthier. And Dr. Kachatrian's protocols are not predicated as cancer healers or healers of any specific disease. They make the body healthy, and a healthy body can normalize itself and get rid of disease conditions. And this does appear to be what was going on. We gave Dr. Kachatrian in the 6 weeks that he was at our clinic close to 40 patients with a variety of illnesses, most of whom had cancers, but some of whom had chronic fatigue conditions and allergic conditions, and in the case of one lady, a chronic ulcerative colitis condition which had not responded over many years and had to be controlled with methotrexate and high doses of prednisone, and even then not with complete success. To summarize, and we did taped interviews with all patients at the beginning, at the middle, and at the end of the therapy sessions, we had very consistently good results with very few exceptions. There was one lady with chronic fatigue who did not improve appreciably. But invariably, just about every patient on the protocol noticed definitive improvements in their general well-being. If they had lost weight, they tended to gain weight. If they didn't have energy, they tended to get more energy. If they were having intestinal disruptions or upsets, those tended to go away. In terms of our cancer patients, we didn't have anybody with stomach cancers. We've had many of them with breast cancer, a variety of sorts. One lady with inflammatory breast cancer improved marginally, but she was not a great success. Several others with more traditional forms of breast cancer did quite well, and at least 3 of them appeared to have no evidence of the cancer at the end of the 3 weeks of therapy, as determined by both cancer markers and also by PET CT scans. So we were getting objective data as well as anecdotal information from the patients who felt that they were doing well. One patient who came to me originally before Dr. Kachatrian saw him with metastatic esophageal cancer had had 2 chemotherapy sessions, which are a confounding factor in determining the success of this therapy. But they made him profoundly ill, and he did not continue those for that reason. He came to me brought by his daughter, and this was an elderly gentleman, and he was wheelchair bound. I started him on nutritional therapies, which did improve his status to some degree. But the 3 weeks of the Kachatrian protocol really was the icing on the cake. He had lost something like 40 pounds and gained 30 pounds back. And this wasn't edema fluid, this was healthy muscle tissue. His well-being improved dramatically. He went from wheelchair bound to being able to walk and get around, to drive his own car. And he had a lot of energy. His appetite improved, and his bowel movements, which had been abnormal, improved as well. So we counted him as a great success. Another patient that we saw was an Armenian American with chronic fatigue and a chronic anemia of unknown origin. And after 3 weeks, he improved clinically to the point where he was able to drive again. Previously, his wife had to drive him everywhere, and he barely could get out of bed, and now he was able to walk and get along.